Hello, good afternoon. We're here today with Elham Roshan-Raven, and she's here to talk to us about the role of nurse practitioner. So, Elham, I hear that you're an APRN. What does that mean?
Correct. APRN is the advanced practice nurse, which is, after you pass the RN, you go to the advanced level and be a master or doctor of the nursing, and you can turn as an advanced practice nurse.
And how did you get into this field?
Yeah, that's a good question. I'm originally from Iran, and I was a journalism, which is completely different field. From the journalism to the medical field is kind of far away, but since I came here, I was working as a medical assistant and interpreter for oncology's unit. So when I was in the field of the medical, I seen how the nurses, doctors, or NP, PA, how they helping the people, how to try to make them, connect, be, caring with them, be so kind with them. I feel kind of find a good relationship between my old previous job, which was journalism, to be a voice of the people and kind of, try to help people out of from, when the voice not hearing, I be their voice. In the medical field, I can be the same. I can help them. I can cure them, hear them, try to, heal them. Those are very good connections. And I feel, why not? I can move back to the medical field. I can move to the medical fields and be a kind of, helping the people in a different way.
So for other people who are watching this video, it sounds like if you did not start in the healthcare field, that doesn't necessarily mean that you can't start anew, correct?
Exactly correct, yeah.
Okay, so I hear that there are different kinds of nurse practitioners, is that right?
Correct. There is 6 different type of the nurse practitioners.
And what are some of those kinds?
There is a midwifery, CRNA, which is the nurse anesthetist, and also psychiatric nurse practitioner. There is a pediatric nurse practitioner, adult geriatric nurse practitioner, and family nurse practitioner, which is I am a family nurse practitioner.
And you're a family nurse practitioner?
Yes, I am.
And so what does that mean? What does that specialty entail?
Family nurse practitioners can see all the range of the ages from the child through the lifespan. So you can see the variety of the patients in the, and you don't have any limitations to see the patients, which is I was looking for. You can see all kind of the patients.
Excellent. So I have heard that there is a little bit of stigma with nurse practitioners in some areas, and that there might be a feeling that they are not as well trained or as well qualified as medical doctors. How do you feel about that?
Yes, there is, but I think since the first Georgia is the restrictions, one of the state, which is the nurse practitioner always have to be under the physician's umbrella. But as long as kind of there is the improvement happening because there is a shortage of the provider, and we always, and that shortage of the providers and the nurse practitioners try to improve the field of the knowledge and see the patients preventing for the cure is getting better, and the doctor try to kind of getting closer to the NP and kind of try to helping each other to improve the medical field in the better way.
Wonderful. So it sounds like nurse practitioners can still help fill a gap.
Exactly.
Okay, well, thank you so much for talking to us today, Elham. We enjoyed hearing about your perspective.
You're welcome. Thank you for interviewing me.